Okay. Hello, everyone. Welcome to Concordia University's fourth space. And thank you for joining us for today's event, Ending Weight Stigma, Priorities for Action. To help situate you, we are streaming to YouTube live from fourth space, and we are located here on unceded Indigenous lands in Chichage, Montreal. Here at fourth space, we work with our university community to help mobilize knowledge. We co-create daily activities that examine research questions and projects, things in development across the university. We're running today's event as a live stream Zoom meeting also. We have many friends joining us by Zoom. So we welcome comments and questions there via the chat. We'll be monitoring that also, and we'll bring that in to the room. Those of you here in the space, if you have any questions, just raise your hand and we'll bring a microphone over to you so that everyone can hear. Okay. With that, it's now my pleasure to pass it over to Professeur en Faculté de Sciences de l'Éducation and the Département de Fondement et Pratique en Éducation, Dr. Mary-Lou Cote. Mary-Lou, welcome.
Thank you very much. So, hi, everyone. As mentioned, my name is Marie-Lou Cote, a new assistant professor at Université Laval in Quebec City, here in Canada. I'm also a clinical psychologist with expertise in eating disorders and body image-related issues. And I'm the co-chair of the 2024 International Weight Bias Summit, along with Dr. Angela Alberga. So it's our pleasure to welcome you today to this live webinar entitled Ending Weight Stigma, Priorities for Action as part of the 2024 International Weight Bias Summit. First, we would like to thank all the 34 attendees from across the world who have attended this summit. For those who have joined us online today, we have here attendees from Mexico, Iceland, Australia, France, Sweden, the UK, and the US, representing overall 3 continents. We would like also to thank all the members of the International Weight Bias Summit Planning Committee. The summit has brought together a wealth of knowledge, experience, and ideas from scholars of different disciplines and diverse perspectives with the aim of identifying research priorities in the field of weight bias and stigma. From a personal perspective, I've learned so much from these 2 days, and I hope that the research priorities and applied practice collaboration we discussed will come to life. Second, thanks to all of you who are attending this online event. In the chat, please tell us where you're from. We would like to know. Last but not least, I would like to thank our valued partners whose support has made both the summit and this webinar possible. So the Social Sciences and Humanities Council of Research Council, of Canada, Concordia University and their School of Health, Bias 180, the European Association for the Study of Obesity, the Obesity Society, the World Obesity Federation, Obesity Canada, l'Institut sur la nutrition et les aliments fonctionnels, INAF, the Research Center Nutris, so Nutrition, Santé, Société, the Research Network on Cardiometabolic Health, Diabetes, and Obesity, as well as Université Laval. We represent many disciplines, backgrounds, and experiences, and the ability to share knowledge and good practice is key to working towards our common goals. It is fantastic to hold this event here at Concordia University, which has a tradition of addressing social justice issues, and thus very fitting with the aim of the current summit. We are thankful to be able to host this event on these lands among a diversity of people. Concordia University, as mentioned, is located on unceded Indigenous lands. The Kenyan Kehaka Nation is recognized as the custodians of the lands and waters on which Concordia University stands today. Tiohtià:ke, commonly known as Montreal, is historically known as a gathering place for many First Nations. I now would like to introduce our panel event, which is focused on what we can collectively do better and what are the best actionable changes we can make moving forward in ending weight stigma. We will welcome questions after the panel, keeping in mind the spirit of diversity and collaboration. So it gives me the great pleasure to introduce our moderator of today, Lisa Schaefer. So Lisa is the new executive director at Obesity Canada and has previously dedicated to volunteering for nearly 8 years at Obesity Canada. She has served as a patient advocate, chair of the Public Engagement Committee, and also a member of the board of directors. She has worked extensively with national clinical obesity experts from across the country. Over the years working with Obesity Canada, Lisa has developed strong connections with the obesity community, particularly with people with lived experience, as well as with clinicians and researchers. Please welcome Ms. Lisa Schaefer.
That kind introduction. That was a very lovely way to start the day. I could not be more honored to be part of this amazing panel discussion today and to have been able to be part of the summit over the last few days as well. As someone from a lived experience perspective, hearing these conversations and being part of these conversations are incredibly empowering. As someone who is now working as an advocate and a leader in the space of obesity and really challenging weight bias and stigma, I just am so fired up and I'm ready to kick some doors in, and I'm excited for the conversation that we're going to have today. So with that, I'm very honored to introduce our keynote speaker that's going to start today. Dr. Ramos Salas has a PhD in public health and over 20 years of experience in health research and policy with the Canadian Institute of Health Research and obesity education, advocacy, and patient engagement with Obesity Canada. Thank you. As a weight, stigma, and obesity expert, she works with several international organizations such as the European Association for the Study of Obesity and World Health Organization. And I have to say, without this woman being in my life, I would not be in this chair today. I'm honored to call her my friend. I am humbled to know you as a human, and I can't wait to hear what you have to share today.
So thank you so much for coming. Thank you everyone for coming, and thank you for that introduction. It's a pleasure and an honor to be here today. We're gonna start right away, and I'm trying to advance, but it's not. There we go. Oh, now I advanced too much. Where is it going? Okay, there we go. Let's get going. So first, I know that there's many people online, and perhaps some of you are not working in this field. So I wanted to start by defining some of the concepts that I'm going to talk about today. So when we talk about weight bias, we are talking about our own individual negative attitudes about weight and about people because of their weight. These negative attitudes can be explicit, implicit, or internalized. And so when we talk about explicit bias and attitudes towards people living with a higher weight, including people living with obesity, we are talking about how we can change these attitudes. And a lot of the research I'm going to talk about today will talk about how we try to change these perceptions. Stigma, on the other hand, refers to the social, deeply ingrained stereotypes about people with a higher weight and about people who have obesity, such as that people with obesity are lazy, unmotivated, lacking willpower, or really are not able to implement the healthcare recommendations that we provide in our health system. And these social stereotypes are existing around the world, and they contribute to that social devaluation of people based on their body size or weight, including how we treat them and also how they cause health and social inequalities. So we're going to talk a little bit about this today. And the reason why these social stereotypes drive these health and social inequalities is because they tend to divide societies into us versus them. So we have this structure where people who don't fit the socially accepted body size ideals are treated as others. And people feel that it is okay to treat them inappropriately or in a discriminatory way because they're simply not fitting the socially accepted body size ideals. So to give you some examples from the healthcare setting, this is the healthcare setting is where I work, where I'm situated on. So our own bias and attitudes and beliefs can actually be explicit, meaning that we use moralistic language when we communicate with patients living with a higher weight or patients with obesity, like saying you are unhealthy, you're a bad person, your weight is bad, you're morbidly obese. These words can be very triggering for people living with obesity, and they can trigger shame and blame in them. Shaming patients for their weight is quite normal in our society, unfortunately, including in the healthcare system. And it includes saying things like, don't you know that obesity is bad for you? Like, don't you know you need to control your weight? Or when healthcare professionals say, I don't really want to see patients with obesity because they're not really trying hard enough. Now, implicit bias is more about believing that weight control is simple and that we have our own responsibility to manage our own weight, or believing that weight gain leads to obesity and instead of the other way around. We know that obesity is a chronic disease that leads to weight gain, but most people think that weight gain leads to obesity, or believing that obesity treatments are ineffective and unnecessary. On the internalized side, we see a lot of feelings of self-blame and feeling anxious of our own weight and feeling less capable because of our weight, or believing that the way that other people treat us unfairly is deserved because we should be able to manage our own weight. And because we haven't been able to manage our own weight, that is our own fault, and we deserve that disrespectful treatment from others. Now, from a public health perspective, which is where I come from, we are talking about framing interventions to be able to reduce these bias attitudes and beliefs from multiple levels. And so I usually talk about the ecological model of health promotion, which includes interventions at multiple levels, including the individual, interpersonal, institutional, and population levels. So starting from the individual, we can do interventions to change implicit and explicit weight bias attitudes and beliefs. And then at the interpersonal level, we're talking about doing interventions to change the interactions and the communications and behaviors and practices towards other people living with obesity or with higher weight. And at the institutional level, we're talking about interventions that focus on preventing and addressing stigmatizing practices in healthcare settings, in education, in schools, in employment or workplaces. And finally, at the population level, we're talking about interventions that would address the social norms about body weight and body size acceptance, for example, legislative interventions to prevent weight-based discrimination, etc. So from a public health perspective, we know that stigma is an independent social determinant of health. And we have decades of research showing that experiencing stigma for whatever reason, whether it's weight, gender, race, or socioeconomic status, experiencing stigma can lead to internalizing that weight bias and stigma. It can affect our practices, our behaviors, and our communications with people. And it can ultimately lead to discrimination, which is the unfair treatment of people because of their weight. And so I think what's important to understand is that this is a social determinant of health, and it affects the entire population, not just the people who are affected by the stigmatizing practices. So I'm taking this page from the Canadian Clinical Practice Guidelines for the Adult Obesity Management Guidelines. And the reason why I wanted to put this table here is because I wanted to show that we have decades of research showing that experiencing weight stigma is associated with poor mental health outcomes, physical health outcomes, as well as healthcare delivery and social outcomes. But I guess the most important piece that you want to take from this is that experiencing weight stigma is an independent risk factor for all-cause mortality. So people who experience stigma are at risk for experiencing a higher risk for mortality, regardless of their weight or obesity or disease that they're living with. And how does this happen? So this is an image that I like to use a lot because it makes it very simple. Like when we have bias, stigma, and discrimination in the healthcare system, it can lead to various effects that eventually have outcomes for people living with obesity. So when we have biased attitudes amongst healthcare professionals, they tend to believe that weight control is an individual responsibility. Stigmatizing practices in the healthcare system can include, for example, not referring people for obesity assessment, diagnosis, and treatment, treatment. And discriminatory practice in the health system can be, for example, obesity not being treated as a chronic disease in the health system, not covering obesity treatments, or denying of healthcare services for people living with obesity, such as infertility treatments or knee and hip replacements just because their BMI is too high. So these effects, of course, have a huge impact on outcomes. For example, we know that healthcare professionals don't think it's necessary to get training on obesity or skills development in obesity to support patients living with obesity. Patients don't seek obesity care from qualified healthcare providers, and they engage in very unrealistic, unevidence-based weight loss strategies that actually increase the risk for more weight gain and obesity-related complications. Obesity progresses to a higher severity, and it reduces quality of life. And I'm going to tell you this little story about it's actually a very impactful story, and it's one of the reasons why I do this. This is a story from a Canadian woman, Ellen, who lived in British Columbia, and for years she spent many years trying to find a reason why she was having a series of symptoms, and doctors just kept telling her that she needed to lose weight and that her symptoms would disappear. It took many years before she found a doctor that stopped making assumptions about her weight and her symptoms and did an official cancer diagnosis and discovered that she had stage 4 cancer. So just days before she died, she discovered that she has stage 4 cancer, and she wrote her own obituary where she talked about how she was fat shamed for many years in the healthcare system, and she didn't get the help that she needed. Now, this story was in the media, and it caught a lot of attention in the media. But for me, it links to the research that we have that women with higher weight and women living with severe obesity are actually receiving less cancer screening for obesity, for cancer screenings. And we know that obesity is also associated with many types of cancers. So this is a perfect example of how stigma can actually have fatal consequences. Now, it also causes inertia in healthcare services in terms of the way that we treat obesity. So this study is very relevant here in Canada, and my colleague Ian Patton is one of the authors. And they tried to assess how the Canadian clinical practice guidelines for adult obesity landed in primary care in Canada. And unfortunately, many of primary care providers still believe that the best treatment for obesity is eat less and move more. And here's a quote from a doctor talking about bariatric surgery, where he says it's very invasive, very permanent. So again, I don't encourage patients to even think about that until they've really made a good effort. As far as counseling, I think there's a limited, it's laughable, I know. As far as counseling, I don't really think there's a limited value in that. People know why they're overweight and people know what to do. So I'm really skeptical about counseling them and trying to get at the bottom of their obesity. Maybe in some people, but for the most part, I don't believe it, that that there's any sort of long-term benefit from obesity treatment. And this person says, I don't think there's enough time. I don't think we're paid enough to manage a difficult chronic problem like obesity. The problem with treating obesity is that the government and insurance companies are still not recognizing obesity as a disease. And here, and hence the treatments we have now, which are quite effective, we cannot use for most patients because the coverage is not there. Of course, we would never say this for cancer treatment or any other disease. There are many conditions in the healthcare system that are covered, but we still treat and help people living with these conditions. So from a weight bias, stigma, and discrimination, my perspective is that this is preventable and that this is a social problem that we need to prioritize and address in public policy, education, and healthcare. But what we first need to recognize is that weight stigma and weight-based discrimination are public health issues and that there are human rights problems that we need to deal with. And we also need to collect data that contributes to that understanding that weight-based discrimination is a human rights problem, and that we need to collect that data and assess the risk factors and consequences of weight stigma and weight-based discrimination. We also need to educate and upskill policymakers and educators and health professionals in the prevention of weight stigma and weight-based discrimination, and foster weight stigma and weight-based discrimination prevention programs, as well as evaluate them, of course, to make sure that we're doing the right thing and that we're having an impact. Now, at this International Weight Stigma Summit, we spent yesterday hearing from all the experts around the world, and I was amazed about the extent of the research that we have in weight stigma around the world, looking at weight stigma interventions from healthcare, education, schools, employment, family context, social media, mass media, public policy, looking at the problem from intersectionality perspectives, looking at it from different life stages like pregnancy and menopause, and also looking at human rights-based approaches for reducing weight stigma. And I know that you may not know, but this is something that we've been working on for decades. And there are many people, advocates, working to reduce weight stigma from many different parts in different fields and different parts of the world. Some of them coming from eating disorders communities, some are coming from obesity communities, some of them are coming from research, academia, others are working in policy. But we all have this common goal and understanding that weight stigma and weight-based discrimination is a social injustice and a social determinant of health and social inequalities, and we need to get rid of it. So that's our common goal, and we may have different perspectives, but we are trying to achieve this together. Now, from a weight bias intervention perspective, there's a lot of research on how we have tried to reduce weight bias beliefs, including through education, through changing beliefs about individuals' control over their body weight, by creating empathy towards people with higher weight or living with obesity, by delivering weight-inclusive interventions, and delivering human rights-based approaches to reduce weight-based discrimination. So I'm going to go through a few slides to show some of the data that we have about what works and what doesn't work. In the obesity world, in the context of obesity, we do a lot of weight bias interventions to change the way that healthcare professionals treat and interact with people living with obesity. And some of that includes providing obesity education for people to understand that this is a chronic disease, and to educate people about the fact that 50 to 70% of our weight is genetic and we cannot control it. Individuals cannot control their own weight, and that obesity is a chronic disease that affects their health. Now, based on this data, what we know is that unfortunately, we provide this content about obesity education, but we're not achieving the long-term effect of changing weight bias beliefs and attitudes. And you can see here from this text that we need more focus on educating healthcare professionals about the uncontrollable determinants of weight, but we also need to teach them about that we need to get rid of these negative attitudes and social norms about body weight in society, because educating about obesity is not enough. We need to also educate people about the fact that denying access to care for people with higher weight is not acceptable. Now, from the attribution theory, we see a lot of focus on training healthcare professionals, again, to try to change the negative stereotypes about obesity. And there's many, many examples of these types of interventions. This one I liked because it included the principles of, weight inclusivity, health at every size principles. But unfortunately, these results show that it would change a little bit of the factors, but it's not sustainable. And unfortunately, we don't have the data to evaluate whether this happens on a continuous basis, whether people remain with those change in improved attitudes. This one talks about trying to change those weight bias attitudes. But what we found here is that people have such deeply ingrained beliefs that obesity is bad, and that losing weight must be done, and that people with obesity need high levels of willpower to overcome obesity, that no matter how much education we give them, this bias remains. And so we need to think about whether we need to develop more weight neutral education and try to educate people about the social biases towards body weight that exist in our society. Now, this intervention is focused also on the attribution theory, and it's interesting because this actually showed that we could decrease the value of the negative value about overweight and obesity and encourage weight-inclusive paradigm shifts. However, it wasn't measured with long-term effects, and we didn't have a control group. So we need to do this research more to be able to see whether changing this weight-inclusive paradigm in healthcare settings can actually reduce weight bias and attitudes. Now, there's also interventions that try to evoke empathy to get people to like people with obesity or people with a higher weight. And unfortunately, the data here is also mixed. The attitudes are very difficult to change. There's very little follow-up, so we don't know if this actually works. Here, they try to use different methodologies, lectures, drama plays, etc. And empathy increased in both groups, but implicit bias remained in the groups. And again, it's not long-term changes. So we need to figure out how to do these interventions in a long term and figure out if we can change these attitudes long term. There's also the weight inclusive approaches that I mentioned. Here's a full day of interactive professional development with reflection and journaling, etc. And again, they reduce anti-fat attitudes and internalize weight stereotypes in healthcare practitioners, which remain significant for 6 weeks. But then they started to drift back to the regressing back to the mean. So we need, again, continuous long-term support for healthcare professionals. In this one, they try to teach undergraduate nutrition students using the HACE principles. And again, we could see that we could increase nutrition knowledge, but the anti-fat attitudes and stereotypes did not reach significant change. So again, from a human rights perspective, there are currently no federal laws in the United States, for example, that prohibit weight-based discrimination, but there are some states that are including weight in some of the protected areas, such as race, age, and sexuality. Some cities are also developing laws to ban weight-based discrimination. And in the Americans Disability Act, there are some legal protections for weight for people with severe obesity if they can determine that this is a disability or if obesity is perceived to be a disability by others. And then there's also examples of anti-bullying laws that are appearing across the US. In Canada, unfortunately, although there's huge public support for the idea of implementing legal approaches to prevent weight-based discrimination, particularly in the employment sector, the public support hasn't really resulted in anything. We should add weight as a ground for discrimination because it aligns with the overall values of the Canadian Human Rights Act to promote equality for all. But there is no legal protection right now. And this study was very interesting because it's from one of my colleagues here in Montreal. And although weight discrimination is more prevalent than any other type of discrimination she mentioned, it's not included. And one of the reasons why the legislators refuse to include it is because they're saying that obesity could be included as a protected area in the Disability Act. However, disability is insufficient, really, to cover weight-based discrimination because people don't just experience weight-based discrimination for their disability related to obesity. They're actually experiencing fat phobia and discrimination because of their body size. And so we need to consider other approaches, not just the disability, and we need to make sure that weight is protected under the federal and provincial Human Rights Act. So in summary, we see small to moderate effect size in the reduction of weight bias in our interventions. We see that we need more than one approach. We need to change attitudes and beliefs, but we also need to change policies so that people don't enact their own biased beliefs and treat people with obesity or with a higher weight in a discriminatory way. I think it's important that we move beyond awareness and information sharing with people and actually give people skills and competencies to treat people living with obesity, to have teachers trained on weight bias so that they can prevent anti-bullying based on weight, and that we train policymakers so that they understand and develop policies that are inclusive of all people regardless of their body size. And we also need more interventions to change the social norms and these ideologies that we have about weight and body size. They are quite pervasive. And so if we have this world where everybody thinks that having a larger weight is bad, then it's going to be very difficult to change these attitudes and beliefs. And of course, we need to see what is promising based on the research. And we see that improving attitudes about people with obesity and about people living with a higher weight, it can reduce the likelihood that negative attitudes influence how we treat and interact with people. And so I think it's important that we continue to do that and that we continue to train and try to improve attitudes. But ultimately, the responsibility, for example, in the healthcare system is not up to the individuals affected by weight bias and stigma to do something about it. It's actually the healthcare professionals and the health system that should take the primary responsibility to prevent weight bias and discrimination in the healthcare setting. And so, of course, patient empowerment is important, and we need to address internalized weight bias in patients so that they can advocate for themselves. But I honestly believe that we first need to work on ourselves in the healthcare system and society, and then try to help people living with obesity who experience these internalized weight bias to be able to manage and cope with this. Now, from a weight stigma perspective, we know that it's experienced and internalized, but the reality is that from a public health and epidemiological perspective, there's very little research. And we know that if we want to change policies, we need this epidemiological research to inform our evidence-based medical, political, and social practices, as well as policies. So I think we need to make weight stigma more mainstream in research so that it's included and so that we can inform these policies. And of course, we need to eliminate weight stigma in society. It should be as a public health priority, as a whole systems approach, as opposed to individual-based interventions. And we need more collaboration. You saw all those groups working together to reduce weight stigma, but we need more people, more healthcare professionals, more educators, more scientists, more policymakers, and people living, experiencing weight stigma and discrimination to work together with us to reduce weight bias. And of course, we need more funding and more rigorous research and to get that empirical evidence, not just in the short term, but long-term outcomes. And we need to design better, robust randomized control trials with different population sizes, and with sufficient follow-up. And of course, from a low and middle income country perspective, from a global south and global perspective, most of the research we have is from Western countries. And we need to make sure that we do the research in other cultures and other societies as well. And we need to try to focus on developing new novel interventions, perhaps using new technologies to reduce weight bias, to move beyond those education-based programs that we have. And from a healthcare professional perspective, I think there is some evidence that we need to move away from just that weight-centric approach to healthcare, and really try to focus on improving health and well-being, as opposed to just solely focusing on weight loss and body size. And I think the training needs to start early from their education in healthcare professionals, as opposed to at the end. And I think that's it for me. So thank you for listening.
Thank you so much, Amanda. I like that's it from me is not a true statement either, because we're about to tuck into a really good conversation. And I'm excited to introduce everybody to the other members of our panel today. The inner patient advocate that only read things about some of these humans and now gets to meet them is completely fangirling. So I have to say that out loud before I introduce you both. But I am thrilled to be joined today with two amazing individuals. First, I'll introduce Dr. Rebecca Poole. She's a professor of human development and family sciences at the University of Connecticut, a leading researcher expert in the field of weight stigma and discrimination. Her work has examined the impact of weight stigma on emotional and physical health, the nature of weight-based bullying on youth, the presence of harm of weight bias in healthcare and in the media, interventions to reduce societal weight bias, and policy remedies to prohibit weight discrimination. Her work is foundational in this world, and I can't thank you enough for joining today. And then rounding out our panel today is also Dr. Stuart W. Flint, who is an associate professor of the University of Leeds, president of Scaled Insights, and an honorary academic for the Department of Health Sciences and Social Care with the UK government. With a specific interest in expertise in attitude and behavior change, psychosocial aspects of obesity, health-related stigma and discrimination, particularly in weight stigma and discrimination and health inequity. He has led work on weight stigma internationally, nationally, and regionally with governments, healthcare systems, education providers, media organizations, and patient and public advocacy groups. He's a fantastic voice to have at the table today, as well as we tuck into these conversations. So thank you for joining. So I know those of us in the room have been part of conversations yesterday that were really, for me, they were incredibly interesting. And I learned a lot about connecting all of those dots and hence the dress today. But there are a lot of dots to connect. There's a lot of fantastic work going on in the world. And, we want to make sure that we're also focusing on positivity in this world. How have we been able to make progress? And I thought maybe we could start there and kind of talk about from each of your individual perspectives and think a little bit about what has worked so far. So from the context and the lens that you bring in this space, what are things that you've observed and progress or successes that we can really kind of anchor to in what we have been able to do to kind of mitigate or reduce weight bias and stigma? So I'll just pass it along this way.
Several people yesterday asked me if I ever get discouraged working in this field. And I think it's easy to feel discouraged, especially when we observe some of the findings of the interventions that have just been presented. We would all like to see more change happening more quickly and more broadly. But sitting from my perspective of someone who's been in this field for 25 years, there has been a lot of progress. When I started in this field back in 2000, the idea of an international summit would have been impossible because there weren't enough people. There weren't enough people even for a local summit or a carpool. I mean, we really had nobody working in this field. If we look at the amount of research that has happened since then, it is remarkable. Certainly, we need more research in non-Western countries, but the amount of research, even from people in this room, is so impressive, and we know so much more than we did when I started out. That is a huge indicator of progress. We also see that this is a topic that is much more in the public consciousness now than when I started. I remember early on in my career, I was starting to do some radio interviews on weight stigma, and the radio show hosts would often use the interview time to make fat jokes and to make really disparaging comments about body weight, very intentionally. And the issue just simply wasn't taken seriously. That is not the case now. This is a topic that national news outlets are talking about. This is a topic that is prevalent in discourse in social media and multiple media platforms. So I see a lot of progress there as well. And then I think there are also certain segments of society where we are observing increased attention, some more than others. And one of those settings is the healthcare setting in the medical community. Certainly, there is a lot of work to be done still in the medical community, but I have seen consistent and collective attention and interest to weight stigma from medical professionals across different disciplines who want to address this issue in clinical practice and implement strategies to reduce bias in clinical care. I haven't seen that level of interest in other sectors of society like employment or education. So we are seeing progress. I think what we need to remember, though, is that we are all working towards a very lofty, ambitious goal. We are trying to shift societal attitudes and change a very ingrained and automatic form of bias. And that takes time. It takes a lot of time. And if we look at other stigmatized groups, we know that it takes decades. So we have to keep that in mind, and we have to look for these examples of progress that really are occurring all around us.
Thanks. I mean, I would only echo what Rebecca's already talked to there. It's a challenge for me, but it's a good challenge that, it's very difficult to keep up with all the research that's now being conducted in weight stigma. That has to be a success itself. But beyond just the amount of research that's coming out, it's also the different nature of the research. It's so diverse. There's so many different disciplines and different perspectives that are working in this space, and that can only be beneficial. And, I'm going to say something that's a bit cliche. Every day's a school day, and I'm learning all the time from all of the different research that's being published. So that certainly is a success. The other success, and similar to what Rebecca's mentioned, is, I also am asked, is it disheartening that your research and other people's research, some of the research we've heard from contributors here today, is showing that weight stigma is not going away. In some instances, it may even be getting worse. And likewise, what I would say is, look at the different organizations and structures that now are trying to make changes to reduce weight stigma. A decade ago or 2 decades ago, certainly governments weren't talking about weight stigma. It's now at the top table. Different royal colleges in the UK are talking about weight stigma and making changes. The World Health Organization have specific sections around what we should do with healthcare professionals and improving education, reducing stigma. They are very much identifying that weight stigma itself is an independent risk factor. You know, that wouldn't be something we would have thought of these types of groups talking about 20 years ago. So that's definitely a success. And there's even been success with media, for instance. And media is one that I and many other people will inevitably criticize in terms of the portrayal of people based on weight status or appearance. But actually, we have seen some changes. It's not been sustained. And there's a lot more work that we could do with media professionals to improve that sustained changes. But there has been some changes. So, you know, I think it's important to note where the successes are and to learn from those. And then for those of us who are developing interventions to make changes in the space of weight stigma, how can we build on that, evidence it, and show that it maybe goes against some of the misconceptions that is often placed at the door of weight stigma that I'm sure many of you would have been asked as well. You know, is this actually normalizing a higher weight status or other? It's not about that. This is a social justice issue, and we need to take action where we can.
Yeah, I completely agree. And I think the biggest change that I have seen is the voices of people who have experienced weight stigma and discrimination, and how that has increased over the number of years recently, that more and more people are speaking out and speaking up and standing up for their rights and are saying, this is enough. I don't deserve this. And you know, I'm a tax-paying citizen like everybody else, and I have the same rights as everybody else. So I see more voices of individuals, people living with obesity, people who don't have obesity, who are standing up and saying, this is not something that we can stand for anymore. There's a little bit of that in social media. I see that a lot. People trying to use social media to change the perception of weight and obesity in society. The other thing, I agree with both of you that healthcare has made the most significant change. I mean, it would have been unheard for weight bias reduction into evidence-based recommendations to be included in clinical practice guidelines before 10 years ago. But now we have more and more clinical practice guidelines that include recommendations on how to reduce weight bias in healthcare settings. And I see that all over, in Chile, in Mexico, in Ireland, in Sweden, in Canada. So it's a global change, I think, in the healthcare system that people are understanding that we had been doing harm without thinking of, certainly we were not doing that on purpose, but we need to change. And there's a recognition that we need to change. And I think Obesity Canada has done a lot of that recognition.
I wonder who did that work, Amina. No, it's so important. And there is a piece of this as well that I just want to give space to for a moment. And that is that, you know, you'll hear many of us talk about obesity. I work for Obesity Canada. And it isn't necessarily just about obesity either. There is an important component of this, as someone, again, with lived experience and who walks the world in this body, that is important to me when we're talking about weight bias and stigma. And that's that body diversity is a great thing. We all shouldn't look the same. And body autonomy is also another really important factor in all of these conversations. So I know we're talking a lot about healthcare settings, which often could mean I'm coming in for care and treatment, which might be for my obesity, which might change my body if I want to do that. But that might also not be what we're talking about. It could be the fact that I could walk in to talk about an ear infection and end up in a 20-minute conversation about my weight that wasn't welcome that day. And it's really about kind of reducing that kind of stigma with the expectation that someone in a larger body would only be in a healthcare setting because of their larger body as well. So I just wanted to take a second and shout that out. But it also leads to this conversation, and I love that healthcare is a great anchor point for us. But it really, what we've said the last couple of days, and what I heard you say this morning as well, is that, you know, we really need to connect with these policymakers because they're the foundational and the kind of the root of how our society can often look and feel. So I thought maybe we can swing there and talk a little bit about how we can engage those policymakers, and wondering what you've seen as effective strategies for researchers to really engage with policymakers and advocacy organizations like Obesity Canada in discussions about weight bias, so that we can really ensure that the research that everyone is investing in and is passionate about actually leads to policy change, gets to go somewhere, which is also why I love that we've called today priorities for action, not just priorities for discussion. We want to do more than navel gaze. We want to do some work. So I'd love to find out from you guys what that has looked like from that policy and research connection point.
From my perspective, I think policy is one of the most important things that we should be focusing on. And frankly, as researchers, I don't think we're doing a very good job. And I think partly that's because researchers aren't trained to engage with policymakers. But we know from many other stigmatized groups how important policy is in really eliminating inequities and improving quality of life. And I've been involved in policy for a long time, but I wasn't trained in policy either. So why don't I just share for a moment what my experience has been like in this arena. Back in 2007, I learned that a state legislator in Massachusetts was sponsoring legislation to add body weight as a protected category to their state's civil rights law. So I reached out and I said, hey, I'm a researcher who's studying this. Can we talk? And I shared the research that we were doing, and he asked me to come and educate his staffers about weight stigma. And I also asked him, what kind of research would be helpful to you in pushing these kinds of policies forward? And he said, I need to know that this is a prevalent problem, and I need to know if people support this legislation. And I thought, well, I can study that. And so I started adding questions to my surveys. And a lot of us here in this room today do survey research. And I did some research to see what kinds of laws were most feasible to pass in terms of prohibiting weight discrimination. And I started adding those questions to my surveys and asking people if they would support those laws. And very quickly, that data started to mount and increase, and it became a focus of the testimonies that I would give at state legislative hearings. And these aren't difficult questions for us to be integrating into our research, but it really does make a difference. Policymakers want research experts on their team. I think a lot of us think, well, I don't know what that looks like. And it's very straightforward. Even giving a testimony at a legislative hearing often means you have about 2 minutes to talk. And a lot of researchers are very, very good public speakers. So it's just channeling that communication in a different way. And it means you have a couple of minutes to tell people weight stigma is a problem, it's harmful, it's a social injustice, and we have ample evidence to justify legislation. And that's it. We also spend a lot of time translating our research into policy briefs, which are essentially 1 or 2 page summaries of what we know about this problem and sharing that with policymakers. And so I would really encourage researchers who are in this space to engage with policymakers. It can be at the local level, it can be at the state or provincial level, it doesn't have to be federal. There are a lot of policymakers out there who are interested, but you can't wait for them to come to you. You have to go to them and you have to take initiative. And so I would love to see more opportunities for discussion among researchers about how to engage with policymakers, training in this area, because it really can be extremely impactful. And in my perspective, I don't know how effective change can be at the societal level without policy change.
Thanks. The first thing I would say is it's really important to do your research on the political groups or policymakers that you're looking to talk to, because there are political drivers that means that policymakers are either willing or not willing to talk to you in the first place, and whether they're likely to actually act upon those things as well. And whether we like it or not, policymakers and politicians, they will need to act that aligns with their political group. So it's important to try and frame your message. It's not to say that what we want to tell them about, because we're really excited and we've got great findings. We want to say, this is my research, we need to make a change because look at the damage that weight stigma is doing. Of course, we want to be able to do that, but how can we frame it to the different political groups that we're maybe talking to? And there are enablers and barriers to doing that. One of the things that is inevitably consistent across the different political groups is that policy typically doesn't get enacted unless there's good public support. The majority of the public ultimately accepting this policy, because we have to remember, politicians are there and they're voted upon by the public. So the likelihood, therefore, is that I'm only going to act on these things if I think the public are going to support these, or I'm going to get enough votes to be to be voted back in 4 years' time or 5 years' time. So, you know, we have to consider that in terms of the likelihood of action as we move forward. And maybe to give an example, we drew up some guidelines for policymakers and politicians and how to communicate about weight and the framing of weight in both public health and obesity related policies. It was something that was agreed by the group. It was a cross party, so there was politicians and policymakers from across the different political groups that were part of that, and it was agreed in 2017. And then the chair decided actually we should go out for public consultation to see what the public think. Now, again, remember, this is for policymakers and the way that they talk about and they communicate relating to weight. It's not about the public, but they still wanted to go out. It took another 2 years, and then eventually it came into force in 2020. So, you know, these are the things that I think we need to consider in terms of potential actions. We need to make our research tangible. I'd love to be able to send my PDFs to policymakers and then for them to say, oh, this great research by Flint has led to these decisions. That's not going to happen. You know, so we need to make it tangible. We need to give them something that ultimately they're also likely to take on and pass to other policymakers, other political groups, and so on. Remember, you know, policymakers, just like many of us as academics, they've got egos as well. So can we give them little snippets of information that they can recall and they'll pass on? Because they'd love to be able to pass on a little message and to take credit for that, of course. But I think those are some of the quite easy things that we can do in terms of gaining more and more potential political traction. One of the things that I have done in the UK, again, in terms of trying to get more support politically, because inevitably weight stigma divides the population, and therefore it also divides politicians in terms of action. Is I've talked to what we have the Equality Act. Some of you will have seen some of the work that I've done in that space. And when I talk to the Equality Act, it's about gaining their support initially. So I talk to, well, what's the foundations of the Equality Act? That means that people are protected against discrimination. And when people look at the Equality Act, the key framings of ultimately what we're protected by is actions such as victimization, it's harassment, it's bullying, it's teasing, it's direct and indirect discrimination. And I talk to policymakers about that. And of course, we all agree that they're actions that should be prohibited and so on, etc. And then, of course, then I talk to, well, these are the experiences that people have relating to weight. But they've already bought in. They've already bought in to say, yes, of course, victimization is not something that's acceptable. So maybe we can use those discussions in a slightly different way that gets their buy-in, and then we bring weight after that. And maybe one last example I would say is, you know, when we're looking at policies that are brought in for public health, but also obesity, when weight is being discussed, I sometimes talk to policies in other areas for different health outcomes, whether it's cancer, whether it's diabetes, whether it's different cardiovascular disease, and so on. And you know, I remove, well, what is the kind of the real target, and I'm talking, well, what's the key essence of what we're trying to get across here? And some of those key things are that everybody should be treated fairly, that healthcare should be a safe space, irrespective of why somebody is attending a healthcare consultation. Everybody should have fair, equal opportunities, and so on, etc. And again, that's a good way, I think, of getting political buy-in and political support for changes to be made.
So I guess what I would add is, you know, there needs to be those opportunities for researchers to be able to interact with policymakers, and they don't have access to policymakers. So one of the things that a mediator or an intermediator there could be NGOs and nonprofit organizations that are advocating for the inclusion of weight as a protected area, for example. So researchers and NGOs, nonprofit organizations, can work together to try to organize research policy interface workshops, for example, so that researchers start to learn how policymakers need the information, what they need from researchers. And so those opportunities, I think, don't happen unless we structure them, unless we organize them. It's very rare that people like Rebecca, like, you know, she called the legislators like, hey, I'm a researcher. But, you know, if we actually created those opportunities where researchers and policymakers are together, that could facilitate. So the European Association for the Study of Obesity is trying to do that, right? Like they're a mediator between policy and researchers. And so they can identify the research experts, they can identify the policymakers and bring them together to start discussing how can we change things. And I think ultimately researchers, the reason why they do research is because they want to create change. Like they're doing this because they're passionate about this. And it is frustrating not to see the change and not to see the impact of your research. But I think NGOs can also help and be part of the equation and part of the collaboration to bring those people together.
They gave us 2 microphones and we keep passing the same one. Sorry, everybody. I love this conversation and it's so true. And again, it's about connecting the dots. And we know that storytelling really does impact change. We've seen that in other chronic disease conditions and just in life. Those who tell the stories rule the world. That we know that to be true. So I love what you're saying. We need the manpower behind the scenes to kind of help us have evidence base, and then we need to take that evidence forward and show how our lives kind of quantify those findings in a whole other way. And again, I often talk about one of the days that my life changed was looking at that spaghetti map related to the disease of obesity and all of the impacts that can really have a factor, and going, I'm that tiny orange dot. And I thought I could overrule all. Who do I think I am? But it's so important to make that kind of visual impact, to have that very resonant moment where people can finally see themselves, especially in this world where people who live in a bigger body and have experienced weight bias and stigma, we have a blind spot in knowing that we should even ask for better or that we deserve better. And that's often a very big starting point. So even telling that story as many times as we need to help that collective push come forward, so that we can really take the hard work that everyone is doing in research, connect it to these advocates, and then see the systemic and societal change that we're looking for. Okay, we fixed it, you guys. We're good. No, there's more to do. And I'd love to look forward now as well and kind of think about how we can take future steps. I also want to just take a second and remind everybody that we are accepting questions. So if you are joining us virtually, get your questions ready, because I think we're going to, after a couple more minutes here, we'll move to that, or people in the room. So get ready for that. But let's look forward and get in our imagination station together and think about what could happen in the future for us. So again, based on each of your individual lenses and kind of the perspectives that you have working in these different settings to address weight stigma, what actions do you think or suggest that we can do to really help connect these dots? What actions can we kind of put to the forefront to say, hey, we know this research makes sense because it's going to path to this, but I know I need to get in an elevator with that certain politician as well and give him that snackable story moment. How can we start enabling some of that? So I'd love to start there, and we can switch up who starts. Or Rebecca, if you want to go for it, go for it. Whomever. Let's make Stuart go first this time.
Make me go first.
Yeah.
The first thing I'd say is we need to do better as researchers, as advocates, as clinicians, depending on our backgrounds. We need to do better in helping the different organizations and stakeholders understand their role here in addressing weight stigma. And it's not just for the researchers or the advocates or so on. Everybody has a role, and we need the different stakeholders. And as Helena mentioned in her keynote, it's a whole systems approach that's required. So from the top down, from policymakers down to the individual level. So everybody has a role if we're going to address weight stigma, because it's so pervasive in our society. And the reality is that, our implicit biases, and many of us, of course, will sit in this room and say, of course, I don't have an implicit bias relating to people based on weight and so on. The reality is that we live in an environment that tells you that people are valued different based on their weight. And we have these messages consistently and continuously every single day. So the likelihood is that at some level, you will have taken on an implicit bias. So, we do need change across the different levels. The other thing I would say is, what can we learn? What can we do? Let's learn from different spaces that is working well. I think, again, Helena mentioned earlier, anti-bullying policies in schools. I would certainly say that's been a space where we have had some success in addressing weight stigma in that setting, because the anti-bullying policies are very good in terms of the way that they describe what behaviors are prohibited and the way that they engage parents. So not all schools do this, of course, but there's many schools that do this very well. And I think by adding weight in there, because I think parents understand the impacts that weight-related stigma has on children. Can we learn from those structures that have been successful? And how can we potentially branch that out to other areas that we also know that we need to make change in? Yesterday, I think healthcare was one of the most important settings that was agreed upon in this as a space that we need to make change. Many of us in this room are working on interventions in healthcare, so we still haven't got it right. So what else can we learn from different spaces where we have seen success?
Yeah, and we had the honor of listening to a panel of people that share their lived experiences with weight bias and stigma yesterday, which is often, it doesn't matter how many times I hear these stories. I mean, I hear them from all over the world. And yesterday, what I heard is that this starts at a very early age. It starts in our families. It starts in our homes. And so I have an 18-year-old and he knows what I do. And so from a young age, I remember having this conversation with him and all his cousins at home is, there's a lot of bullying happening in schools. And I agree, there's anti-bullying policies and in schools, and my son's schools had one. But I was saying, if you're going to comment on someone's characteristics, personality, whatever, if that person cannot change that in 30 seconds, don't say it. Don't say that comment. Don't make that comment. People can't control their weight and obesity, right? And so don't comment on things that people cannot change. And so that kind of helped him to realize that, yeah, the bullying that's happening is often making fun of kids for things that they cannot control, they cannot change. And so that clicked with him. And so we have the policy in our homes. We don't make fat jokes. We don't, we raise attentions. If somebody says something that is biased, we talk about it. And I think in some families, we're not doing that. And then at the school, at the workplace, at the education settings, in healthcare, all those settings are perfect opportunities for us to do something. But it starts with us as individuals, and then we need to work ourselves up to changing how we interact and how we communicate and changing the social norms and the policies. It's going to take time, like Rebecca was saying. It took a long time. And, in fact, I would say I'm a Latin American woman, and, I experience racism on a constant basis, but we have laws and policies to protect from that from a racism, right? And so, for example, I could be a doctor and a physician, and there's policies in my institution that prevent me from enacting on my racist attitudes and beliefs, right? And so why don't we have that for weight bias and stigma? So maybe you don't like people with overweight or obesity, but it should not affect how you treat people living with obesity in your job as a healthcare professional. So we need those policies. So eventually, I think we're going to get there.
So if I kind of think back to your question, I think this is about how can researchers elevate impact. And in my career, when I think about what's had most impact, it's when I've collaborated with organizations outside of academia. And that's a hard thing to say as a researcher. We are incentivized for scholarship, and we are evaluated on scholarship and publications and presentations. But the impact of that is limited to researchers in academia. And where I think I've had more impact is when I've tried to identify, what groups can benefit from the evidence that my studies are showing. What groups can use this for meaningful action. As one recent example, I've been working with a national nonprofit in the United States called the Media Empathy Foundation, which tries to bring attention to people with stigmatized identities in media and in entertainment media and news media, and how to change those portrayals. For me, media is just as important as policy if we want to change societal attitudes. And for the past several years in our collaborations, the research evidence that exists on weight stigma was instrumental in this group really elevating the issue for media content creators. In addition to creating webinars for media content creators about weight stigma and creating educational resources, the Media Empathy Foundation hosted 2 national showcase events for media content creators, where I was a panelist alongside the president of Lionsgate Motion Films and senior producers of national news outlets. And that's impactful. When we are talking to people who are creating television series and films, one thing I've learned from a lot of these discussions is these are very well-intentioned, smart people who want to tell meaningful stories, but weight stigma is not on the radar. When it's on the radar, they start to get it. And so, those kinds of collaborations have been impactful in a way that I could never have just as a researcher sharing my research with other researchers. And so I think, there's a lot more that we can do when we publish a study to think about which groups would benefit from this. We're all working on weight stigma, but in different areas, and different groups are going to resonate with your work. And thinking about how you can, again, identify those groups and reach out, let them know what you're working on, share your evidence, and look for ways to collaborate. This is engaged scholarship, and it really is, I think, something that we need to be doing a lot more of.
I love it. That's so fascinating to me, and it's one of my anchor points as well. And people may have heard me say this before. We can't be what we don't see. So it's really important that the media does reflect what the societal change that we're looking for is, and that we're seeing people that are living in bigger bodies throughout different stories or plot lines, and where they're not the very special focus of that episode as well. And I also wanted to say, I know we've kind of been taking this lens of researchers, policymakers, and advocates. And I'm going to give you guys all a new designation that you can add to your printed business cards. All of us are advocates. We all have the opportunity to use our personal power in whatever space we have to advocate for this change. Some days for me, that's when I'm at the grocery store and I just flip a magazine around to the other way so that not every person in line has to see you can get a flat tummy in 10 days. Because you can't, or just taking the moment or taking that breath. I love what you were saying about your home and having that as like a through line. And sometimes it doesn't have to be make the hugest footprint, because as someone as well who has lived her life being shamed, thinking that was going to create change, that also doesn't really work effectively. So it doesn't have to be a shame moment. It can just be an awareness moment. We have blind spots. We all do. And that's also part of that, implicit, explicit, and self-bias that we have. And sometimes the best thing that we can do for someone else is just help them recognize a bit of a blind spot that they might have while they're navigating this world. So I like that. So welcome, everybody. You're all advocates now. Thank you for joining us. Speaking of which, I would love to know if we've got any great conversations or questions coming from the audience.
Thank you. Hi, everyone. I'm Angela Alverga. I'm the co-chair of the International Weight Bias Summit. Thank you so much to our live audience who's here for this event. And thank you to our incredible panelists for this very powerful discussion. We have some excellent questions online, so I'm just going to read them. We have one question from Janice Forsyth, and her question is, how can people with lived experience help reduce weight stigma, either on their own or in partnership with researchers?
So I think that's a really great question, because one of the things that I mentioned at the beginning of our presentation is that people with lived experience who live in a body with a higher weight or with obesity, they have internalized these negative attitudes and beliefs about weight. And it's often something that we don't want to deal with it ourselves. It's very difficult to deal with it ourselves. So in the clinical practice guidelines, we recommend cognitive behavioral therapy and acceptance therapy as a way to deal with that, because I think if we don't address the internalized stigma, the self-stigma, it's very difficult to stand up and address external stigma. And I often hear from advocates themselves that say, it's taken me years to be able to share my story and to talk about it and to talk to my family about it and to talk to the media about it. But every time there's these micro situations where somebody says something, it triggers that self-stigma again, and it takes me back. And so I think we do need to protect ourselves when we're standing up against weight bias and stigma, understanding that there will be triggers, because most people have internalized weight stigma, and stigma is something that is very common. So I think one way to do it is to find a group of people who are willing to support you in your advocacy. And so there are many nonprofit organizations around the world now, and even in Mexico, Obesidades is there creating that voice. In Chile we have groups. So more and more I see people standing together and helping each other advocate for the elimination of weight stigma. And it's not something that we can do alone, but we can work together by finding other people and communities that are willing to do this with us.
Yeah, maybe just to add, I mean, inevitably, I think that, the lived experience is extremely important. Do we need to do it alone or together? Overall, certainly together, but there might also be times when the lived experience without the researcher is going to be just as, and maybe actually more powerful than me getting over there and telling people about things that maybe we already know. Certainly more opportunities for people with to give their lived experience is critically important. We also can't assume that the lived experience is the same. Of course, it's very complex and people live different lives. So we need to hear from more diverse voices about the lived experience if we're really going to understand and then make tangible change, I think.
Yeah, so I think, again, this is another area that researchers can put increased effort into, which is engaging people with lived experience into their work. I'm currently part of an international working group with a number of people who are actually here today working on some developing measures to assess lived experiences with weight stigma. And engaging people with lived experiences has been a very important part of the development of that work. So I think, again, being very intentional to include people with lived experience in helping in the development of research and informing the research questions is really important. And I think, just to echo what Stuart is talking about as well, is the importance of understanding that people with lived experience represent an extremely heterogeneous population with very different perspectives and viewpoints and histories and experiences, and that all of those perspectives need to be included when we are talking about people with lived experience. I think we can be doing a much better job in recognizing that diversity as well.
Maybe just one more. We also talked a lot about intersectionality of stigma yesterday as well, and there's a lot of groups, I think, therefore, who are experiencing weight stigma, but other types of stigma as well, and we're not really understanding or hearing those voices. So I think there's a lot more that we could do in that space. I think, again, if we're going to get the diversity of information that's really needed to make change in the space. So whether it's stigma that is about other health outcomes as well as relating to weight, or whether that stigma is relating to race or to gender or to sexuality, I think that's critically important, because, a lot of the other types of stigmas that people will also experience will compound weight stigma. So I think that's critical for us to think about as well when we're taking this field forward.
Another piece that I'd like to anchor to, as someone, again, lived experience, who kind of came up and I'm at this table because I chose to be an advocate. It's because I had a day where I decided I really wanted to get curious. And I wanted to get uncomfortable. And I would encourage people with lived experience, you feel like they may have a story to tell, but might not feel ready yet, to get a little curious with themselves and maybe even write out their story. Think about what they really wish people knew that they don't know today. I would say, let's start there. Let's get curious together, because if we can't be curious and we can't be even confused, because confusing is a part of this as well. Where are the lines between what is obesity, weight stigma? It's nuanced. Be confused, be curious, because when you're doing that, you're not being stuck. You're open to getting new information and challenging the way you think. So I would invite people with lived experience to take that path as a first place to start, and then be clear about what your boundaries are. Clear is kind. You may have a story that you want other people to hear, but you maybe don't want to be the face of it. So find a way to work with people like Obesity Canada, like other NGOs, who can help push your narrative forward without necessarily having to push you out on a stage as well. So I want to make sure people are comfortable and hear that piece as well, because capturing your story can be really impactful on a lot of levels without you having to be center stage. So let's make it easy for people to do that. And I would challenge organizations like mine to find ways to build better bridges as well. And let's create a space where we can have this collective of either a speaking panel or these narrative voices that's easy for researchers to tie into to, and then we can help make connections, because we do know, again, those are incredibly powerful.
Okay, I'd like to actually ask some members of our audience. We are very lucky to have an incredible audience of many, many, many experts in weight bias and stigma and discrimination around the world. So we're just wondering if we have any questions from the audience here. We have Ted Kyle.
So Lisa, thank you very much for making us all advocates. And I'd love to hear about a word I stumbled across when I was thinking about this, which is equipping people to be upstanders. Can you tell us a little bit about how we do that and the value of being an upstander? It was new to me too.
Sure. So yeah, that's amazing. That's a really good question, Ted. I think we have seen that when people stand up, things can change. There's a history of that in the HIV and AIDS movement, in the racism movement. We have seen in the social justice movement, the women's rights movement, that when people stand up, there's value in that and it creates change. And I think we need to have that empowerment and think about how can we empower ourselves? Because really in health promotion, we say you can't empower other people. People empower themselves, right? So you need to find a way to empower yourself to stand up and advocate for yourself and others.
Yeah, I mean, we need to empower other people. We talked about how can we help other people to potentially advocate. We need to be advocates ourselves, but we also need to support other people to advocate and to give their lived experience and voices and so on, etc. So we certainly need to do that. And what I would also say is that, many of us around this room who educate, and also online, I'm sure, who educate about weight stigma, the light bulb moment goes off for many people. And then the question, of course, is, okay, so how many people want change? And everybody is, yes, great, we need change because weight stigma is terrible. Again, how many people are willing to make changes themselves? And the hands go down. So, we need to be able to, we need to be prepared to make change ourselves. And we, of course, are weight stigma researchers and we're learning and so on. And that might mean that we still need to make changes as new evidence comes out as well. So, I think we need to lead by action ourselves.
I think that social media platforms are actually a really great domain for where upstanding can occur. And, we often think about social media as the enemy for weight stigma. And there's a lot of really terrible stuff on social media that reinforces weight stigma, but there's also a really large amount of empowerment happening on social media platforms through the body positivity movement and other groups and organizations. And, I think that we need to be thinking more about how we can harness social media for empowerment and upstanding, especially when we think about how much youth are using social media and who need that support and empowerment for youth of all body sizes. There really are no places that youth are getting messages of support regardless of their body size. And I think we need to think about, as researchers, as advocates, how can we create more platforms where we know youth are going that have those messages of empowerment and acceptance and body esteem, because they're really not getting them very many other places.
I got a laugh now. I'm good. Ted, was your question how? Was that like how to help people be upstanders? Remind me.
Well, in various types of change that people are seeking, you see people talking about equipping people to be upstanders instead of bystanders. And when they see injustice, when they see somebody talking about the obese, then, I often find myself in a situation where I am in awe of people who say, let's go back and talk about what you just said. Just hang on just a minute without attacking someone, offering that thought. And so in sexual harassment, in any number of contexts, there is the concept of equipping people to intervene on the spot.
And that can be really overwhelming and intimidating. And I think one of the best things we can do to help people, empower people in those moments, is to get people to ground in their why and remember that that is bigger than just this one conversation we're in. And to also be realistic about what your expectations are and what success looks like. Because some people are going to be like nailing Jello to a tree. We know we're not going to win. So manage your energy a little bit as well. And, share the word. If you see something, say something. But also know if this is going to be more triggering or more upsetting than it's worth, then walk away. But remember your why. And for me, that's often, I think of younger version of me and the kind of grown up that I wish was in the room sometimes when things were happening to me. And I use that as my foundation to go, I know how I felt in that moment. And I wish somebody was there to just go, that's not okay. And I know you might not know why it's not okay. And there's a lot of information I could share if you're open to it. But if you're not, I just, at the minimum, need to know that wasn't okay. And sometimes that's as deep as we go. But you know what the best sanitizer in life is? Sunshine, right? So we need to shine light on these moments. And that is one of the big wins that we can have as well, is to shed light on these moments. Ted, you and I are going to have a good conversation.
An example, I recall, I spent, it felt like years in a state health improvement plan process. It was like paint drying to figure out how we were going to deal with, in Pennsylvania, the epidemic of obesity. And the conversation in the room was all about how we can get people with obesity to change their behavior and stop being the way they're being. And I started talking about weight bias. And then this person who'd been very quiet in the room says, excuse me, but as the fat person in the room, I'd like to just say something. And she felt safe to say that. And a few years later, suddenly Pennsylvania is one of the few states that is covering across the board all obesity medicines as a preferred formulary item.
And that's the key, right? We need to focus on asking for the societal and systemic change in a way that invites people to join us, not to other people. We've heard in the research here today alone that othering doesn't work. It isn't impactful. So we need to challenge these conversations and these norms in a way that invites people to join. And not everybody might be as bold as that person that was in that room. I love that human, whoever that was. But it is important also to recognize that your voice has value. So that's often, again, why we want people to start with getting curious with yourself and understanding what your internalized bias is and challenging your internalized bias to say, maybe even if today I put up my hand for the first time, that's actually going to be a huge step. And anything we can do to crack this and get more light on the conversation, the better I think we're all going to be as well. Go for it. I think we have another question from Jen.
Yes. Hi, everybody. So Jennifer Brown, I'm a registered dietitian at the Ottawa Hospital. I'm going to bring my clinician hat into this question. And Rebecca, you had a really good point about that from researchers to policymakers, and being kind of, I look at the clinical role of being almost like a conduit between, supporting the lived experience, bringing the research to practice, but then affecting that change. So kind of a similar question to what Janice had asked online. What can clinicians do to help push that needle forward or help to affect change at the policy level? Any suggestions?
Yeah, again, clinicians are highly valued people to inform policymakers, and policymakers love when clinicians come to legislative hearings to testify. They are providing, again, experience of what they've observed as clinicians and how bias is impacting the lives of the people that they're working with and treating. So I would really encourage clinicians just as much as researchers to be engaging with policymakers. You don't have to have research evidence in front of you. Your clinical expertise and talking about the problem of weight bias in healthcare is wonderful and very impactful as well.
And nothing really to add other than, also about influencing the healthcare community. It's very well me going and speaking to lots of different healthcare groups, but if a clinician or another healthcare professional can do that, they can probably do that better than I can because they're respected more within their community.
So yes, I think clinicians have a huge role. But I think many feel that they don't have the skills, so they would need the advocacy skills that researchers need, that people with lived experience need. They also need advocacy skills, and they also need to understand policymakers and how they think. So one of the things, I sit in a lot of policy meetings, and they look at me like, oh, Jimena, you're telling me this is bad. You're telling me this is harmful, but tell me what to do. So policymakers expect you to go there with a solution. They don't expect you to go there and have a dialogue and a conversation, because they don't have time for that. And so I think clinicians can also go there and say, okay, we have this, we can do this. Like go there prepared, have a conversation that is informed, because oftentimes most policymakers tell me, we have advocates, we have clinicians, we have researchers who come here, but they're just not telling me what to do. You need to be specific. Tell me, what do you want me to do? And I think we're bad at that. As advocates and as researchers, we go there and think, we're so passionate about this. And of course you got to do something. I don't know what, but you got to do something. And so I think we need to be more prepared. And the policy briefs that Rebecca talked about, like the key recommendations. Okay, this one thing you can do, you can create a policy that prevents bullying in schools. You can create a policy in your hospital that makes sure that patients who come into the hospital from wherever entrance, emergency room, whatever department, that they're accommodated and that there's a safe space for them. This doesn't require, like, you have to give them the solutions. That's my point.
Mm-hmm. We need to be a bit more tactical, and also, to Stuart, some of the things that I've heard you say as well is meet them where they are as well, in these policymakers in this moment. And sometimes that can be, again, being realistic about what the outcomes are that we're asking for. And yes, they want a solution. And how do we eat an elephant? One bite at a time. So don't present the whole elephant. We got to represent that first bite. And I think one of the places I would love to see clinicians push policy is even just challenging our own government to make sure that our websites, the information that they are putting out as a public health authority, reflect the right definitions of obesity, that they are not stigmatizing unto themselves, and that they're checking their own bias along the way. So we do need to make that actionable. Another place that I would love clinicians to join us, and this is where they can add even more to their long titles often again, is being that advocate, and the way that can look in a clinical setting. And I heard this story from someone that's at the event here today is, reflecting this change that we want to see in the world. So yes, there are certain biometrics that you're going to have to take on appointments, but do I need to know what my weight was that day? Probably not. And there was a beautiful story of an elegant experience of somebody who was like, oh, what was my weight today? And the response from the clinician was, if it was a concern, I'd bring it up. And that helps unto itself. Just take away kind of some of that, because the narrative in a person's head is going to be very much up here. And when you have those experiences, I can also say as someone who, again, had challenges in healthcare settings, when you have that really positive moment, you're like, wait, what? This is possible. And then I'm going to tell two friends who are going to tell two friends. And that's also how we kind of get this grassroots and groundswell from the bottom up moving. So by being a clinician that is reflecting this change and just helping, and we recognize there's a lot of limitations. You don't have all the time in the world to necessarily give me the whole narrative arc of weight bias and stigma. Then just show me by being that difference. I think we have another question from the online community.
Yes, we have so many great questions from the online community. So thank you so much for your excellent questions. I'm going to read one from Martha Simmons, which I think is an actually really nice segue from Jen Brown's question and a nice discussion that you've had with the panelists. So her question is, how much progress has been made addressing weight bias early in training for healthcare professionals? How impactful have those efforts been with young professionals? And if I may add to Martha, what would you then recommend for better training for healthcare professionals to address weight bias and stigma?
Well, the short answer is that there hasn't been very much effective movement in this area. For years, I've been talking to deans of medical schools to try to get weight bias as a topic onto the agenda, and it needs to happen very early in medical school. But there's a lot of competition for topics to be included in medical school curriculum, and this is often at the bottom of the list. But this can't just be something that we wait to educate professionals on once they become practicing clinicians. This needs to start early. These students are arriving to medical school with weight bias fully present. So attitude change and education and training needs to happen a lot earlier. And I would actually say, in the bigger picture, this should be happening with children in schools early on. We need to be integrating this topic into education in elementary school, because the attitudes that children are exposed to starts very, very early. Those become ingrained over time, and then it's very difficult to change. And again, schools are an area that I think are ripe for intervention where we have not seen enough. There are a lot of diversity curriculums in place in schools now. Weight is often not considered an aspect of diversity, and it needs to be part of that. There are ways to integrate topics of weight stigma in almost every subject area that we learn about in school, whether it's social studies or English or something else. This topic can be integrated into learning early on. And so I would say that, we need to take a step back and even think about, if we want to have a society of people who respect individuals regardless of their body size and who are not engaging in weight bias, that has to start a lot earlier. But the medical school piece is really important. And I want to just emphasize that it's not just important for medical professionals who are training in the obesity field. This is important for medical professionals in every single specialty. And so there's a lot of work, I think, that needs to be done in reaching other specialties outside of obesity or nutrition or eating disorders, to really make sure that this is on the radar.
My perspective would be is prevention of weight stigma, weight bias needed? Inevitably, yes. The question is when does that start, and what's going to be impactful? Does it start in the medical curriculum? No. Should it be there? Yes. It doesn't start there, of course, as Rebecca's just mentioned. Students are turning up with weight bias. Where does it start? In schools? No, because again, often children are taking on stigmatizing attitudes from before they actually get to school. So, that's probably one of the kind of key questions. What's been successful, and Jimena mentioned this, of course, also in the presentation, interventions haven't been that successful, really. We have seen some successes, but they've been very short-lived. And I think that's also one for us to consider, because methodologically, either our interventions haven't been robust enough, but probably more importantly, they've not been long-term enough. The reality is that when we're trying to shift an attitude that's been developed over 30 years, and I've had continuous and consistent messages every single day that says people are different based on their weight status, well, attending a webinar for an hour, or taking on some training, or being exposed to some short-term videos is likely to not have a beneficial impact, certainly not long-term. And it's the long-term change that we need, because of course people return back to the environment that tells them people are valued different based on their weight status. So I think we need to think about that. We need to be developing sustained interventions if we're likely to see a shift in weight stigma attitudes and behaviors.
So I guess what I would add, and it will be from the obesity perspective, because this is where I work. I think, yes, it has to start early. It needs to be more than just education. It needs to be skills development. It needs to be like, how do I talk about weight? How do I talk about obesity? And very practical for healthcare professionals and students. And I think it needs to be long-term sustained support for healthcare professionals to be able to change those attitudes and beliefs, because it's not easy. And we don't want to be shaming healthcare professionals either, because shaming doesn't change behaviors. We know that, but we need to be able to support them to change it, because they have this ingrained bias and we all have it. So I think, whenever I do education for healthcare professionals, I always start with like, we all have it. We all have biased attitudes, and we just need to be aware of them. And then we start addressing them and changing them slowly through our practice. And one of the key things that the obesity community is focused on with healthcare professionals is try to develop practices that are focused on improving health and well-being and supporting the individual to be healthy and to have health and to achieve the optimal health that they can achieve, rather than focusing on weight loss or body size changes. You know, like this has been a shift in the obesity community over a number of years, where more and more people are understanding that we are treating a disease. We're not here to change how people look. We are trying to improve health and well-being, and that shift is happening more and more globally. Obviously, Canada, North America, Europe, we've been talking about this for decades now, but I see it globally, that educators are getting to the point where, and when we talk about obesity, this is a chronic disease when excess or dysfunctional body fat impairs your health and well-being. If it doesn't do that, you don't have obesity, and you don't need weight loss or treatments for obesity. And I think that distinction needs to happen. People in training for healthcare professional services, they need to know how to diagnose, how to assess obesity, and they need to understand that there's a difference between having a larger body size and having obesity.
Maybe one last thing I'll also mention is that, maybe we need to take a different approach here. We're coming at this as addressing weight stigma, of course, as we should do, and also weight as being the key focus, but it's also a contentious one in terms of people's perceptions. And, I already know we're coming up to January, and I'm going to be asked in January, because everybody's making New Year's resolutions. The media are going to be asking me the same question they've asked me for the last 20 years. But isn't weight stigma at some level going to be beneficial? Doesn't it help people to increase their motivation to want to change their lifestyle and all of those types of stuff, which is complete rubbish? But that will be asked. So maybe, the change of approach that we need to have here is, a consensus on, what are we trying to achieve? And maybe that's about respect. Maybe that's about evidence. Maybe that's about equity. All of those things that I think, I'm kind of going to where I started in policy, in thinking about policy and getting the majority of the public's backing and so on. Or maybe actually we can get a consensus on these are the key things that we're trying to address. And maybe that helps us in this space, because there's still a lot of voices that are saying, actually, weight stigma is beneficial. Weight stigma can be useful. So maybe actually that's an approach that could be useful here.
Are there any other moments where stigma is beneficial? Okay, moving on.
Well, not in the health context as such, but stigmas in some aspects, around not wearing seatbelts in cars and other aspects like that. There has been some bits of work that's shown that that's fostered more seatbelt wearing and not drinking and driving and things like that. So, I think that's probably the spaces that people would talk to, but certainly not any topic area that I would say is anything that's comparable to weight stigma.
Because those are all behaviors.
Well,
and weight is not a behavior.
But that's, of course, is one of the key challenges. And I don't really want to open up the can of worms of talking to the issues we've had about smoking and obesity and all of those campaigns that have been quite detrimental at times. But again, that goes back to, where do we see weight stigma? And where do we see weight? Or even a health outcome versus a behavior. So, there are challenges that we have in this space.
So to answer the question, we're working on it. And I think really to answer the question, or just to reflect on the question that was asked a little bit, I think everyone's in agreement, though, that it's an important piece of this puzzle, and an important component for us to focus on those new professionals as well, and getting humans in general as early as possible to really understand this conversation and join us in this moment.
Do we have any other questions here in the space? Excellent.
Hi, thank you all for your presentations today and conversation. I'm Amber Hewitt Garcia. I am a Board of Trustees member for the World Obesity Federation and also a founding director of the Global Obesity Patient Alliance. We know from our data work globally that 51% of the world will be living with overweight or obesity by 2035. And no country has halted the rise of obesity. We've not made significant progress. I think also if someone with lived experience and lived with obesity my entire life, my advocacy was born and thrived because of community through Obesity Action Coalition and the work that I did here. I think my question for you all is, as we try to build a global community, we have countries that are we are a long way away from having a lived experience patient organization. So what other coalitions or NCDs advocacy. Do you think we can bring into that group to have a unified advocacy platform when it comes to prevention, management, and treatment of obesity? Who else can be in that coalition?
I mean, I don't have an answer because, and I think if I tried to answer you, it'd be a long list and we'd be here till Sunday maybe. Because the reality is that weight stigma is impacting many different groups. So if you're talking about NCDs and other health communities and so on, cardiology groups, British Heart Foundation, there's lots of different groups who could be on this conversation, probably need to be on this conversation at some point, because weight stigma is not just impacting people relating to weight, it's impacting people relating to many other health or background related, topics that's also experiencing stigma. So is there more stakeholders to bring to the table? Inevitably. Is there more work to be done in certain areas? For sure, and we've been doing quite a lot of internet, and I say we, it's the royal we, many people in this room, international consensus work and so on. And there's some assumptions that I think we've made in certain areas where we haven't got evidence relating to weight stigma at the end of very early on in that journey. And I think we need to understand how weight stigma is being experienced in those areas, how it's impacting people, and then we understand, well, what stakeholders do we need to bring to the table in those areas, because they're not always the same, of course, as they are in the UK or in North America or elsewhere.
I think what I would add to that is that we need to be thinking about organizations outside of obesity. When we talk about community, we're talking about social support. And that doesn't have to be around the topic of health or obesity. And I think we've got a lot of obesity organizations at the table. What we don't have is a lot of organizations that aren't focused with obesity at the table. So, creating community internationally means multiple diverse groups. And so I think some of the efforts could be focused there.
That was my thought as well, is to kind of understand who has got somebody's ear or who's already at that table, so we can help draft off of each other, rather than trying to necessarily have to cut new ground. How can we amplify and work together? And I think that goes for these developing countries that you're referring to specifically, but even here in North America or in our developed nations, how can we start supporting each other? We've learned so much, pardon me, recently about this cardiometabolic moment that we're kind of in, and understanding how much is interconnected. And if we see obesity, and again, that's different than weight bias and stigma, but if we see that as such an upstream disease, it kind of benefits us to partner with some of those people that may already have an ear or a place in these developing countries, for sure.
Yeah, and I think if I would say one last thing for this whole panel is that we have to understand that weight bias, stigma, and discrimination happens across the weight spectrum. It's not just people with obesity who experience weight bias. Yes, they're more likely to experience it, but people who are underweight also experience weight stigma. We have this obsession with body size and weight in our society. And so I think everybody should be part of that discussion, not just obesity groups. I totally agree. It needs to go beyond obesity. And it needs to go, talking about, social justice for all and human rights-based approaches. That's the direction I think we want to go towards, where we promote the understanding that every human being matters, no matter what weight or disease or NCD they're living with.
Yeah, maybe one last thought as well is about the political groups that we're trying to bring to the table. In the majority of instances, it's going to be health-related political groups. And I think what we don't see enough of is departments of education, work and pensions, all of the other government groups that, again, have a role to play in this space. Do
we have any more from the community?
Yes. So we have many questions from the community. Here's a question that we thought was very pertinent to our discussions and being at the International Weight Bias Summit here today. The question is, are there any international collaborations to prevent weight stigma? Perhaps maybe something will also follow from this summit, considering we have so many collaborations across the world here already. But I'd love to hear some of the panelists speak about this as well. So thank you, Lena, for your question.
What I can say is that most of the international groups that I know that are working on this are primarily from a research perspective. And I think there's a lot of room here, again, for expanding to a cross-disciplinary kind of international network and collaboration. I think this summit actually is a great springboard for creating international networks and communication, and really trying to make that a more systematic effort. I think one of the hallmarks of weight stigma work for a long time is that efforts have been scattered. And I think we need to do really more concerted work to bring more systematic efforts together and across different countries, and not just Western countries. I think that's the other issue that we've seen with certainly with research, is there's so much coming out of Western countries, not a lot elsewhere. And so I think active and concerted engagement of countries all over the world is really important here. But again, not just focusing on research or science or obesity, really focusing on this as a broader social justice and human rights issue.
I think we're all in agreement. And I think where my brain goes is I often think in proverbs as well. So you'll learn that about me. But, if you want to go fast, go alone. If you want to go far, go together. So I think collaboration really is key in being able to take this conversation farther and deeper than necessarily any one of us kind of cutting through on our own.
Yeah. So the only thing that I would add, I know that people come from different perspectives, and eating disorders, obesity, whatever we're talking about, there's gotta be that discussion where we come to like a consensus about what are the common goals that we can agree on, what are the things that we can work together on. Perhaps it's not everything, but we all agree that weight stigma and discrimination is an injustice and we need to get rid of it. So I think we can leave aside some of those perspectives and individual silos and try to close the bridge there a little bit, because like Rebecca was saying, it's very siloed right now, and it's pockets of activities and there's no working together. And I think it could be delaying the changes that we want to see.
Does anyone in the space have another question? Oh, perfect.
Kind of piggybacking on where the conversation just turned, I was thinking about the summit that we've had this week, and you couldn't bring together a more friendly or like collegial group of people. And so we all seem to like each other, and we all seem to have a very shared goal. And that's across organizations and institutions and different disciplines. But what Jimena was sort of getting at is there's still very, very different sort of philosophies and perspectives about what we're talking about. And I wonder, like, to what extent are those like very different viewpoints, whether it's from a research perspective or an advocacy perspective, to what extent do those maybe create barriers to this priorities for like developing consensus and priorities for action? So we have a shared goal, but very different ideas about what that goal means or how you get to that goal.
Yeah, what I'll say, I guess, is, if experts who are focusing on weight stigma across different disciplines can't come together to find common ground, then what hope do we have for the rest of society? And at times this is very frustrating. And, I'm someone who was trained in the eating disorders field initially, and then also in the obesity field. And so from those two fields, just as an example, I have perspectives on both sides. And there are a number of times I've been brought into meetings in groups with very polarized perspectives to try to find common ground. And there are times where it kind of feels like I'm the only person who thinks there is. And, where one area where I do think a lot of us agree is that this is a social injustice, and that weight discrimination should be illegal, and that it should be a protected characteristic along other civil rights and human rights. And so I absolutely think that one area of common ground is policy when we talk about human rights legislation. And I could see every single person in this room testifying at a legislative hearing to further that goal. So I think that's a good place to start. I think that, we're certainly at a time where there is polarization around language. I think that that is in some ways holding us back, but I also understand that there is a lot of diversity when it comes to language and preferences, and we need to be respecting the diversity of language. And again, I think just bringing it back to the idea that when we talk about people with larger bodies or higher body weight, we're talking about a very heterogeneous population of people with different perspectives and histories and lived experiences, which means we need to respect all of those different perspectives and that there is room for all of those perspectives in this conversation. I would love to see more listening and less anger and attacking, and I think that we're all capable of doing that, and that there are a lot of examples where that is happening. But for me, an easy kind of low-hanging fruit is that we all believe this is a social injustice and can be at the table for that conversation to start.
Love that. And that actually brings us to a really nice place to kind of round out. And I think we can just build off of what you were just sharing there, pardon me, is, I think at the end of the day, we're all part of this world together. And part of what we need is to shift that public perception of weight bias so that we can kind of support and foster this environment that we've been painting this picture about, so that all of us that live in these different body types can feel like we're seen, we're heard, and there's a space for us as well. And there's something in there about space and grace for me that's important for everybody to be able to move into new ways of thinking or changing policy or changing how they've approached things. But I'd love to hear from each of you as kind of like a way to bring us around and wrap up our conversation about what kind of strategies do you think researchers could use to kind of effectively communicate to the public? And again, maybe that's through a partnership, but what are some of the ways that we can kind of start cutting through and actually moving towards the society hearing us in a different way? I'd love to go there just to kind of wrap up.
I think that's a great question. And it's something that, again, that researchers really aren't trained to do, right? We're trained to communicate to other researchers. But where I think some of the most important work comes from is what happens after your research study is published. Traditionally, researchers are focused on doing the study, getting it published, and then moving on to the next study. But I think some of the most important work happens in between that, and what you do with that published research in terms of translating it and communicating it for non-research audiences who can use it for meaningful action. And that does take time and it takes effort. And it's not something that researchers are trained to do, but it's also something that makes your work so much more impactful. So I would encourage researchers, if you haven't already, get to know your Office of Communications at your institution. And when you have a study that is published, write down some bullet points that just explain why you did your study, why it's important, and what people can do with that information. See if they're interested in doing a press release. Sometimes the answer might be no, but sometimes it will be yes. You can also think about how would you summarize that research study in a one-page handout and what groups could benefit from that. You can record yourself spending 2 minutes talking about your research findings and post that on social media. You can engage in a podcast. You can reach out to reporters. There are so many ways that we can really try to get our research out there. And I do think that step is critically important. When we think about the media, this is a particularly influential source of weight stigma. The media is responsible for determining a lot of public attitudes. And there's actually a lot of good research that exists that is in published journals showing the presence of weight stigma in the media and the harm that being exposed to that in the media causes. But who's not reading those articles is the media industry. Right. So, we need engagement of researchers and the media so that they can really be informing the messages and educating the media on what is accurate and how to avoid stigma. So I would love to see that as kind of a take-home message for researchers that, spending more time communicating about your work to non-academic audiences.
Yeah, I would echo that. And I started off, I think, in responding to the very first question about making our research and our evidence tangible and being able to tailor to different audiences. I think that's key. We probably need to think about how people are consuming information at the moment, and are we actually delivering or disseminating our information via those means? So whether that's using different forms of social media, whether that's through podcasts or other, those are the things that people are going to for their information. And so we should be translating our information into those types of sources to try and reach the different groups and to potentially have an impact. It may even be that we're developing partnerships with other groups who are able to have that influence. They already have a network. They already have, followings that's been built up, and maybe actually working with those groups will also help us to translate our PDF, our 4,000 or 5,000 word articles into something that's a 2-minute impactful piece that goes out to a population of young people aged 14 to 18. So, I think we need to consider, well, how do we translate our messages into something that's consumable for different types of groups? And again, I think it's about tailoring to different audiences.
So I guess I'm going to take it from a whole different perspective, because my background, of course, is working with a research funding agency, the Canadian Institutes of Health Research. And there was this movement that started, many years ago about, we need to do research that is going to inform changes in the healthcare system. And so rather than just funding research for open discovery, like whatever you want to do, ask me for the money, I will give it to you. We changed towards the idea that we need to fund strategic research that will inform policy change and healthcare changes. And I think now we live in this movement where research needs to be working towards creating person-centered health systems. And I think researchers need to start having more dialogue with persons who use the healthcare system and ask them, what are the questions, what are the research questions we need to engage in, so that you can use that research once it's ready for publication, right? And so I think we can do both. We can do open-ended questions and research projects, but we also need to work together to identify the research priorities so that we fund strategic research that will be available for uptake for use and will create the change. And I think this summit was trying to do that, right? Like we were trying to bring the users of research in this meeting to tell us what should be the research priorities in the future in weight stigma, not just from a researcher perspective, from a lived experience perspective, from a clinician perspective, from a health system policy perspective. What should the research priorities be? And what do you want us to do as researchers? I think that's another thing to look at it. There's the idea of like, we need to get better at disseminating the research we do, but there's also the need for us to do research that is needed and that will be available for uptake in policy or practice.
I love this. So we need to be a collaborative effort together that is understanding what is the right or most important thing that needs to be addressed first. We then need to actually collaborate and meet people where they are and work with the organizations and the systems in place that already have our ear, and kind of bring them up this mountain with us, because we know the water is going to wear away the stone. We need to be the constant. They are going to be the variable. I'm just going to keep speaking in platitudes today. But it's very true. We need to be resonant, but impactful at the same time, which is no small ask. But I think with the right collective and the right coalition of people at the table, we can pick those 1 or 2 things that we think will be impactful. And then we can amplify those messages so that we can learn that it may not have just worked in this part of the world. What can I build off of from that to make it make sense in my part of the world or my part of the day? So we have a lot of the right ingredients at the table, and really now is our opportunity to move forward and really make these priorities for action and really tuck in together and work on this systemic and global change. I think this is so exciting and this is so amazing. I am so fortunate that I was able to take part in the summit for these last couple of days. And the temperature is telling me very much that there is an interest in creating this international kind of coalition for this exact kind of conversation. And I know we were waxing a bit poetic at dinner last night about the idea of making this summit a reoccurring event or creating this coalition. And I think the appetite and the time is now. So I would invite everybody to stay tuned and think about how you want to continue these conversations, because I think we will definitely be investing in ways to bring these conversations forward. I know we do hope to publish a paper on what we come forward with out of the work that we've been doing here at the summit. And there's definitely a lot more conversations to be had. But I just want to take a second and say thank you to this amazing panel for the conversation that we've had today. So thank you all. Amazing conversation. And really the root of this conversation was formed in the development of this 2024 International Weight Bias Summit. And that did not come at a small amount of effort. I know there was a great deal of sweat equity that went into creating what has been these last couple of days and this last few hours that we've had together virtually as well. So I wanted to take a moment and just thank that Summit Planning Committee. And rather than butchering everybody's last names, I'm going to go with first names. But to Angela Alberga, actually, I will give your full name, my friend, because you really are the person that has created this moment and brought us all together, along with a lot of these people on this panel. So Mary Lou, Orle, Sarul, Vida, Mary, Brad, Angela, Hiba, Tanya, Sarah, Ian, Rebecca, Jimena, Shelley, Sabrina, and Adelaide. That is a reflection of some amazing humans from around the world that really invested their time and talent in making the summit possible and therefore making this moment possible. We also really want to thank our valued partners whose support really made the summit and again the webinar possible for us. The Social Sciences and Humanities Research Council of Canada, thank you for your investment. Concordia University and their School of Health, thank you for letting us have this space and also creating the environment that we've been able to have. Bias 180, the European Association for the Study of Obesity, the Obesity Society, the World Obesity Federation, Obesity Canada. Oh, there's a French one I'm gonna butcher. L'Institut sur la Nutrition et la, oh, I'm gonna mess it up. I'm gonna stop. Some fantastic French organization, the Research Network on Cardiometabolic Health, Diabetes and Obesity, and the University Laval. And again, I wanna thank each and every one of us that showed up today as yourselves and is joining us. And remember, you're an advocate. You have space, you have grace, you have the power to make change in this world wherever you are in any moment that you have. So join us. Let's continue these conversations. Let's be kind to ourselves and at least one other person today, and be well. So thank you everybody for the investment of time and energy today. It's been a fantastic conversation.
Just a quick note from us. Thank you everyone for joining us today here in the space, but also online. There were so many great questions popping up, conversations happening there. I know Mary Lou and Angela and the whole team were watching and looking at that, and it was just great to see. I'm just going to let you know, however, we're going to be closing up that Zoom and live stream now, but it remains available on our YouTube channel. You need to revisit it, and you should, and share it there.